So, introductions in Peer Wellness, the Peer Wellness Collective. As I mentioned before, I'm Katrina Killian, the Executive Director, and I am joined by Genevieve Diani, Director of Operations. So, a little bit of history about the Pure Wellness Collective. So, first and foremost, we are formally known as the Alameda County Network of Mental Health Clients. So, we've been around since 1988. We were founded by Sally Zinman, Howie the Harp, and a few other grassroots advocates who are the pioneers of the consumer movement. Over time, the movement began in the late 60s, early 70s, particularly when there was a huge shift in how mental health clients were receiving services in our system. So there was a huge push for folks to come into the community. Unfortunately, there weren't a lot of services made available for folks in the community, particularly services provided by folks that had lived experience. And so Sally, Howie, and a bunch of other courageous folks, ushered in the movement where we are able to be where we are today. And it is providing services for folks that are like us, that we're able to utilize our lived experience. And so the Pure Wellness Collective has been from the very beginning a 100% peer-led and operated program of Alameda County. And so here is a list of some of our programs. The Berkeley Drop-In Center is our very first program, and it is still alive and kicking and thriving. The Tenant Support Program is our second in line program that provides support services for folks that are living independently in the community. Reach Out is a activity center that provides lots of support groups, wellness groups. For right now, we are 100% online, which I feel gives us an opportunity to reach more folks, particularly during this transition as we are coming back in the community from COVID. Reaching Across, Reaching Across is our community program. Reach Out is our community visit program. And so this program does a lot of visits to folks that are in locked facilities and folks that are living in board and cares. The idea is to eliminate stigma and discrimination, but all in isolation, but also to make for sure that folks living in these communities have access to community resources. The idea and the goal is to encourage and support independent living. Best Now, the was baby of our organization, is our Medi-Cal peer support training specialist training program. The program has been active since 1998, providing trainings and other workshops, preparing folks with lived experience to work in the community, serving people like us. And our most recent program, and we're very excited about this opportunity, is People's Place. This is the very first peer respite and crisis response program that is 100% peer operated in Alameda County. So yay, Peer Wellness Collective. We're very excited. A lot of work has gone into this transition, but we're very happy to be here and really looking forward to all of the cool stuff that all of these programs will provide in the future.
So as Katrina talked about, we have 6 programs now. We've been growing and growing in the last 30 years, from our first program in Berkeley to now providing trainings statewide throughout California. And really in it all, we've kept our core mission and our core values. As Katrina stated, we are at the heart of it, peers. That's it, we're peers. Our mission remains to be, as a BIPOC peer-led and operated network, to provide culturally responsive mental health services, specifically by and for folks historically underserved and or inappropriately served, in order to create a just, safe, and healthy community for all. And we say those 2 words, underserved and inappropriately served, very intentionally, because we know that our community over decades, right, has been supplied with a multitude of different services, a multitude of different initiatives, all of which, not all of which, but very often that were not appropriate, that were not led by peers. These initiatives held large gaps of lived experience between the providers and the people actually seeking those services. And so they didn't work. And so our mission, our core of it all, is to eliminate that gap as best as we can and to provide services that are appropriate and that work, because we are also that community. Our mission, our values that we stand behind, we value community, we value peer-driven, we will always be peer-driven, we promote mental health, we are committed to equity, and we hold ourselves accountable, which is really important. Because we're growing and changing, right? We have to continue to hold ourselves accountable to not lose sight of these things. And so part of our core values is working to dismantle kind of the air we breathe, right? So we live in the United States, right? A country founded in racism, right? This is the air we breathe. And no matter who you are, we are brought up with these ideas, right? That progress is bigger and more, that conflict is bad, that when conflict is brought up, we get defensive, that we should strive for perfectionism, and that the work has to get right, that there's this sense of urgency. And those things are all just inherently present unless we actively work against them. And so something you'll hear through the theme of this presentation is in cultivating a community of care to be really intentional about combating these things as they come up in the workplace. And the reason that this is included in our conversation about supervision is that it really needs to start at the leadership level, right? This needs to be addressed and talked about when we're talking about cultivating a community, when we're talking about trauma-informed supervision. This is a piece of it as well. And so the question that always follows is, well, this is present, right? This is present in our society. What do we do to combat it? It's here. And it's not going away anytime soon, but there are certain things we can do to decrease it. So what we do at the Pure Wellness Collective is we call these the antidotes, right? So these things that we can do to try to lessen the effects of pervasive white supremacy in our culture and inevitably in the workplace. So something we really try to emphasize from the get-go is that it's okay to make mistakes. And that's a lot easier to tell people, and it really has to be demonstrated. So how do you respond when someone makes a mistake, right? I was recently in a yoga class, the yoga instructor was saying that when, a toddler, when they're learning to walk and they fall over, you don't say, oh, they failed. You say they're trying their best, right? And that's the same thing when it comes to all new tasks, right? When we mess up, that's part of the learning process. And we really promote that here, that it's okay to try new things and to make mistakes. That's part of learning. We really center our do no harm values. And what that means is that, we don't live in a utopia, right? Our workplace, still things happen, feelings get hurt, right? We accept that we have all been harmed and will cause harm, but we talk about what harm is and what we can do to prevent it and how to admit when things were wrong, right? So that's all part of it too. We talk about the power of and. We talk about this a lot in the peer community, right? So we're not invalidating each other, but we're talking about how important it is to have a diversity of thought, right? We talk so much about the importance of a diversity of lived experience in the workplace. And what diverse lived experiences promotes is diversity of thought in the workplace. And so really promoting this idea of and is so important. We practice transparency, which is the antidote to power hoarding, right? You might work in, if you've worked in a corporate setting, there's kind of this cloud above you in leadership that you don't really know how choices are made, how decisions are made, but you just hear them and you have to go with them, right? So what we try to do is be really transparent, not about us without us. When big decisions are made, the whole organization is involved. One reason it took us a long time to get a new logo, you might see our email signatures have been changing every once in a while. We have a new logo. We've been trying different iterations because we want everybody to be included in the process, right? Our logo, our new name, that's a big part of us. And we wanted to make sure that everybody had a say in that process. We'll talk a little bit more about what dual supervision looks like, but that's another way to make sure that the power is not just all in one person. Same with dispersed decision-making power. It's really important in leaders. Oh, sorry, a painting just fell over, sorry.
That was me sneaking up behind you, sorry.
Yeah.
Oh my God.
This is what we go when we're renting, you know, and you can't actually put the nail in the wall and you use those strips and you're like, it will work, right? It doesn't always work just how you think it would. Ooh. Decision-making power, that's what we were talking about. So it's really important to have dispersed decision-making power, right? This is another way to combat power hoarding, that there's many people in the organization that make decisions. All those decisions are made collaboratively, but you know who holds decision-making power, so just those decisions can still be made. And it's not a secret about who has that decision-making power. It's, you know who you can go to talk about things, and it's not all just the same person. Another thing we'll talk about is how to be people-centered. Means that there are many paths to one goal. And so when we're working with in a community with diverse lived experiences, diverse thought and ways of doing things, we're not going to make everybody do something the same way, right? That doesn't work, right? If we're in leadership, we know when someone new comes on, we have to let them figure out the way to get their deliverables done. We can't say it's A, B, and then C, right? We have to let them figure it out on their own. And that's understanding that there's many ways to the same goal. Yeah, I think I covered them all. Katrina, anything to add?
I would love to hear from the folks in the room via chat. What are some things that jump out to them that are things that they resonate with, that are a part of our list to actively dismantle particular practices in the workplace?
Or notes about how to properly hang a picture? Anything would be helpful. Ann Nicholson, yes, I see your hand is up.
And whenever you're ready, we're ready for you.
Thank you. I was trying to find the unmute button on this new way they have it. I'm so sorry. I'm working on it. Okay, hello. I was in the car, so I didn't want to be on camera while I was in the car, but I just parked. Okay, so I really love everything that I'm hearing because I was just in a SAMHSA webinar, you know, that like national, and there was so much discussion about supervision, you know, and most of it was negative. People being supervised by clinicians, all of this power hoarding, people not understanding our role. And so I just love everything I'm hearing. You know, so thank you so much. I think transparency is so important, as you say, that you know who to go to, that everyone knows how decisions are made. I mean, this is so important because most of us have experienced a lot of traumas in our life, and a lot of it has been, it has made us very sensitive to people having mysterious, you know, things that we can't understand, how decisions are made, and everything is a secret. So I just really so much appreciate the way you all work there, and you all letting us have a little bit of a window into a new kind of culture. Hopefully we can be inspired and bring more of this into our own cultures. So thank you.
Thank you. The one that stands out to me the most is wellness over deadlines. And I constantly preach and practice about, it doesn't matter how you get to the product as long as you get to the product, but your wellness is the most important thing in that process. And so I really appreciate seeing that there.
Yeah, something we talk about a lot is that deadlines can move and change, right? Your wellness is more important. I think we've all worked in a work environment where if you don't meet a deadline or a deliverable, it seems like that's going to be the end of the world. And we try to promote that it's not going to be the end of the world if you don't meet that. It's just work. And this work is never ending, right? In the field that we're in, we're never going to finish a work day and go, oh, well, we solved it. There we go. Right? So the work is never ending. Anybody else? I saw Julie that you had your hand up.
Yeah, some of the things that really resonate for me here are admitting when wrong, and encouraging healthy conflict. And sometimes those are together. I feel really strongly about, as a supervisor, my responsibility to always to model my peerness, that's how I connect to people that I work with and my team. And I like to say that we just have different responsibilities. We're still peers. And just because I have responsibilities that are, I have different responsibilities, it doesn't make me a bigger peer or better. I'm not any better than anybody else. I just have different responsibilities. And I try to be really transparent and admit when I'm wrong and, that's what I thought. And now I think this, or, just model things. But the healthy conflict is a big one for us, because for me, it's an opportunity for us to practice those skills that we're helping other people learn. And if we can't do that together as a team, to me, it means we're not able to really support other people. And so whenever that comes up, I always turn it around and say, hey, what are we doing here? And why are we doing this? And so those are the things that resonated for me.
Yeah, thank you so much for bringing up that idea of peerness and just that idea of us. We talk about not about us, without us. And I think in the peer community, we talk a lot about who that us is. And a sentiment I hear a lot is that sometimes people will get into leadership and then that us changes. It's no longer us as peers, it's us as an administration or a leadership. And so keeping with that us as peers, us as a collective is so important. Thank you, Julie.
We have Jason.
Hi, thanks. I put this in the chat. I really like this framework. Can you give me an example of written communication as secondary when, for example, we're a direct service provider and our contracts require that we document our services. And in many ways, we see it as support to develop the written communication of peer specialists so that they are able to successfully communicate in writing peer services rather than services in a case management kind of language. So how do you go about written communication as secondary when there's a need for peer specialists to document their services in writing?
Yeah, and we're going to talk more about, the documentation piece of supervision as well. And leadership, I'm sure you hear this a lot, write it down, right? Written communication as secondary means that when we're having a conversation verbally, right, those agreements are still in trust, right? Those conversations still happened, and we follow that up with written communication. So that comes as the secondary form of communication. But our primary way of communicating is still with talking with one another, with collaboratively communicating before we get to that that written word, right? And when we talk about worship of the written word in white supremacist practices, it's like, this is written and this is it, right? And so written communication as secondary is talking about how we're arriving to that collaboratively, and then we're coming up with that written word together.
That makes sense. Thank you. And that can apply in the direct services relationship and the supervisory relationship. Got it.
Absolutely.
Okay, let's get to the next slide.
Cool.
So cultivating community care around your hiring practice. And so you want to be intentional and build in the supports from the very beginning. So building flexible policies and procedures that support challenges instead of penalizing. And so really looking at how do we make the appropriate adjustments? Because here's the thing, we're all peers, right? No one is perfect. No human being walking the earth is perfect. And any challenges is not a one person challenge, it's an us challenge. And so our perspective around looking at policies and procedures is how do we create a practice that supports the individual throughout coming through the door the first day to moving on if that's what they choose to do. And so we talk about building the flexible policies where there may be more opportunities to get it right opposed to penalizing. And we've seen those policies. Well, you got 1 infraction, 2 infraction, 3 infraction, you're out of here. It's whether here is a challenge. What do we need to do to support this not happening, not just with this individual, but organizationally? How do we shift those? And our policies and procedures are built around, working as a peer and what are those needs versus what are the needs of the agency. So develop creative hiring practice. And so, build job descriptions that value lived experience. Our approach is making for sure that as folks come in, that it's understood that your lived experience is a primary component in our hiring practice. In most traditional settings, folks veer away from sharing about their lived experience. But for us, because we are such a diverse agency and we're peers top to bottom across the board, our services really require some diversity in the staffing. That includes diversity in your lived experience. What has gotten you to this point is just as important as what book you picked up, what school did you go to. All of those things are equitable for us across the board. We use a pre-screening to allow the applicant to share more about themselves. And so what we've learned is your resume does not tell the whole story. Right? And so before folks get to an interview, we operate from a pre-screening process where we have a casual conversation with an applicant. Hey, we've got your resume. Here are some interesting things that we saw. We want to hear a little bit more about it. It gives us an opportunity to create a space where a person can share more about how did you even come to this space to even want to do this work? Again, giving folks an opportunity to really focus and share their lived experience, and it gives us an opportunity to see where they may match in this particular role, which helps us move that individual on to an actual interview process. We use a panel approach with diverse staffing, and so folks from throughout the agency participate, folks from other programs that may not have an open position, to leadership, to someone else that actually works at that agency. We really try to have a diverse panel of folks to be a part of the interview process. Develop an interview tool with questions, scenarios, definitions, and other approaches. For us, we really want to get to know the individual, and sometimes their values and their perspective will come up in different ways. You can ask a person, well, why do you want this job? And it can go from everywhere from I need a paycheck to this is my heart work. This is where my passion is, and this is why. And so when we have, questions, and then people can share with us, what does recovery mean to you? That's us getting a little bit deeper about who you are as a person. And then the scenarios gives us an idea of how people might be able to manage particular situations that come up. Our scenarios and definitions are based on real-time activity, things that have actually really happened on the job in some of our programs, so that we're able to really measure whether or not an individual feels strong enough to really work in this particular setting. And we have 6 programs, and there are no 2 programs the same. The experiences will not be the same, and the needs of the staffing, excuse me, will not be the same. And when you get through this process, hopefully you hire the best candidate.
And just to talk a little bit more about what that pre-screening looks like. A lot, like in the peer community, right, we see that sometimes people have these like large gaps in employment, or they're coming into behavioral health services for the first time, and maybe their resume doesn't reflect a career in behavioral health services. Maybe they've been working in the service industry until now, right? We want to make sure that we're not discrediting people because they didn't have the opportunities, right? The SB 803 just passed. There are just now becoming more opportunities for peers to be in paid positions in behavioral healthcare services. And so we're not going to discredit people for not having been able to maybe use their lived experience in professional settings, but maybe they're grassroots advocates that have been doing this kind of work in their personal time with their family members, with their community, right? And we want, and that's just as important, and that's just as great experience. And so we use that as an opportunity to hear about that, those kind of experiences that might not be traditionally put on a resume. Makes me think particularly about the interview process that we did for the crisis team, because these resumes were coming in, we're seeing that very few to no peers had experience doing peer-led crisis services. And we were wondering, well, why is this happening? And we said, well, this didn't really exist before. So how can we ask people to have experience doing it? And a really good measure that I heard is don't ask for 3 years experience if this opportunity wasn't available 3 years ago. Any questions, or does anybody feel called to say anything about this?
Hi, I just wanted to comment as I reflected on some interviews that I had early on in my career as a peer specialist, and some of you may relate to this. The question that is sometimes posed to the interviewee by the interviewer of, can you please tell me about yourself? And sometimes I would defer to telling about everything other than my professional background. So it's just so refreshing to hear that lived experience can become a part of the hiring process, of our professional elevator speech, if you will, and that lived experience is just as important as work history, as education, as honors, and any other accomplishments that might light up a resume. So thank you for your presentation.
Thank you.
And I also had a DM from somebody that asked, and I'm wondering if we can answer this as a group. So I'm in a supervisory position. What do you do when you have to take on responsibilities that quietly become expectations?
Responsibilities are expectations, but if they weren't initially agreed upon, this is where advocacy, self-advocacy comes into play. Just being very clear about what you're experiencing and what you can manage and what you can't manage.
I see Julie put in the chat, boundaries. Yes, creating these boundaries from the start. I've noticed that you can usually feel that very early on in the process at wherever you started working, right? saw this job description, you thought it was a great role for you, and then you start it, and all of a sudden there's all these other things that weren't in the job description that you're being asked to do and that you're being evaluated on, right? And so as soon as that starts happening, it's really important to talk about that. Maybe talking about with your coworkers if they're having a similar experience. Yeah, and Anna's saying, we provide disclosure training, telling your story as part of, yeah, and it's in our interviews, yeah.
Mhm.
Any other questions before we move on? All right.
So building a successful foundation. So you've gone through the screening process, you've hired the right candidate, and now you want to set them up for success. And so our review process is employee driven. So it comes from a strength-based approach, and it's a discussion of what's working, what's successful, and where are the challenges from the perspective of the employee, the person, implements and has a discussion around what they observe. So we implement a 30-day, 60-day, 90-day review process. A part of the first 30 days is developing the deliverables and goals together. So the question of where do you see yourself in 30 days? What do you hope to accomplish in 30 days? That's the foundation of where we start. And so it helps the person have an idea about the direction that their role is going in. It presets the agreed upon expectations. Like by the end of 30 days, this is where we'd hope to be. Now, keep in mind, a plan is just a plan. A goal is just a goal. It does not mean it's the end of the world if we don't meet it. It just means that there may be some things that we might want to do differently, or the goal might change midway. But the most important component is that it is a shared, agreed upon approach. So when we agree upon something, we're more likely to accomplish it. And we, really try to stick to being realistic about what we can and can't accomplish or what the expectations are, and that it's a shared process. So, and the focus is also on, as we get into the 60 and 90 days, we also, a focus on the accomplishments. So we've gotten through the 30 days. Did we meet some goals? How are those deliverables looking? Okay, so we accomplished these things, so we can gold star these areas and then move into, if we haven't, what were some of the challenges? Again, it is not a you or a person challenge. It is a us, we challenge. And so we work together to develop the potential solutions to anything that may come up during that process of the 60 day, 30 days, 60 day, 90 days. And a part of that process is developing the dual supervising structure where there is a point person and a direct supervisor. So for example, Genevieve and I are on the admin team, and we have our program managers. So we have 6 program managers. We have about 5 people that are on the admin team. And she and I actually share the responsibility of supporting and developing that team. We both show up with unique skill set as well as the folks on these 2 teams. However, she and I may not necessarily be the right person for every person. And so folks on the team have an opportunity to really engage both of us. We provide different things, and it gives the dual supervision so that folks have 2 people that they can connect with, whether they have questions about something or if there is really a huge challenge that we need to figure out a game plan for. But again, it is an us approach. It's a us problem or challenge, and it's a us solution. And I think that's something unique that our organization has been able to grow from the very beginning, because we are peer-based from the start. We have not had to reconstruct a system. We were able to build a system that worked best for the folks that we work with. And then built in, there is an intentional focus on self-care, right? So when you're a supervisor, we've been trained to veer away from hey, I'm observing, like, is it something going on with your mental health? Like, we don't jump there. However, there is a duality of this thing is happening. Is it skill set and a challenge with performance? Or is there something impacting your ability to perform at the capacity that you would like? And it comes from, again, from the staff. I may be having some challenges in these areas, and we really make for sure that we're being mindful that wellness is more important than deadlines. So if there are things that come up, we still leave it in the employee's basket to bring it forward. And then we figure out together what kinds of supports or adjustments need to be made to make for sure that that person still maintains their success, that they stay on the path of success. And that's going to look different for every single person. But the idea is to be really intentional about focusing on self-care. And so we don't penalize people if they can't be present or if they need more time, or we just figure out realistically, what does this need to look like and what can we agree on?
And something we found really important is putting those in the review document we use also. So work-life boundaries is in our review. So when we do annual employee reviews, that's part of it. There's a whole section on, adherence. And that's, are you in line with our diversity, equity, inclusion policy? Are you upholding the work-life boundaries that you've set for yourself? Are you prioritizing your wellness? Because you can talk about it, right? You can say that you promote it, but it really has to be embedded in the policies and procedures that you're using in your workplace as well.
It has to show up in your practice.
I also think it has to show up in our modeling.
Mhm.
Like that when I frequently say I'm going to take a day for myself because, or I tell people how I'm planning that, or I feel like it's really important. Even if I'm doing really okay, I want to show that's how I stay okay. I don't just take a day when I'm not well. I take time to stay well, and I feel like that's a responsibility, and I actually have to check myself frequently because I'm not inclined to do that. I'll do that for my staff though. I'll do that for my team. I'll model it for my team sometimes before I'll do it for myself. And that's, so I have to check myself.
Yeah, I totally agree. The modeling has to happen for it to be real. And it, for us, our practice is what informs our policies. Because you can create policies and have a really, really hard time living up to those policies. And so we built the policies based around what has been our natural practice, what has worked for our team. So we create and build the policies around that. And modeling is absolutely one of them. I would never impose or ask someone to do something that I'm not willing to do. And I definitely would encourage folks to take care of their wellness as I would do myself. And so things like coming in later, leaving early, taking a day off, things like that are all a part of, the process of people really focusing on the self-care as they're providing care for others.
Stephen, I see you have your hand up.
I do. Thanks, Genevieve. I've found that in peer-run organizations, that supervision is really coming from a framework of peer support. That it's here is what I can do, what support I can provide for you. Would you like some support? And which of these or all of these can I share with you? And can we work together on this? So there's so much more apart from the dominating school of managerial school of things that I learned in school, in graduate school, is that this is so different. I have to unlearn all those things about how to run a hierarchy and what supervisors can do and how you can get rid of those how you can trim the fat, how you can cut the dead weight, whatever it is, those awful expressions that people want to use to do rather than to honor and value what people can provide for the organization and help them find that within themselves. And then, or not even help, because I don't like the word, support them in finding them within that themselves, because we don't help. We don't have to help. And even supervisors don't have to help. We support. We're there for people. We offer them choices and options as to what supports they would like to do the work in their own creative style, and recognizing that and seeing it as it grows. It's like, wow, I didn't see that in this person when we hired this person, but look at what's happening. So I really appreciate everything that's been said and done so far here, and appreciating that this is what's being honored and looked at right here. So thank you.
Thank you. I'm wondering if we should share the, or maybe a part of the materials that's shared out later, our 30, 60, and 90-day process.
Yeah, I think that would be great. If people are interested in it, we can share that.
Yeah, because I really like it. I'm really glad that we shifted to that. And I think we get so much more out of the supervising relationship when people are able to really identify things that, work for them. So, as we're going through the process and working through the 60 days, 30 days, 60 days, 90 days, we're also looking at ways to create reasonable approaches to staff support. And for me, the number one thing is exhaust every option. Like, a person departing is like the last thing that we get to, because the goal is to support people where they are. We are who we serve. We are folks that will present with some challenges at some point. And the goal is to, create a path where folks can be as successful as possible. And so when we're talking about a reasonable accommodations, it's exhaust all options. And sometimes that might look like changing the schedule, changing the time someone comes in, reducing the days, shifting the duties. Like, there's so many things that can happen before we're releasing someone. So approaching challenges as a program challenge and not an individual challenge, particularly if it becomes a theme, there is this challenge that continues to happen. There's something that we need to work on, not the individual, but us as a collective. We absolutely walk in the process of cause no harm. So any action as a supervisor or as an organization that we take, it's really coming from a place of causing no harm. And so really walking in reassurance and supporting people as we get to the real challenge. Let's get to the root as we work together and really try to dispel any fear that may come up when folks, may not want to share what the challenges are out of fear. And, again, it is a us challenge and not a you challenge. So being realistic about work-related expectations, be willing to make appropriate adjustments, so changes to work activity and deliverables. And so, as I mentioned in the beginning, we set the deliverables together. And so it's agreed upon what the expectations are. And at some point, we may need to change that. And so we get to the shifting as soon as possible, because again, we want the individual to be successful. That means you might have to move some things around before you land on exactly what's working. So that could mean adjusting the schedule. As long as it's within our work hours, we can absolutely make some shifts and changes, really get creative if it means that the individual is going to be successful. We might identify that there needs to be some changes in their role and responsibility. Maybe, the front desk navigation component might be overwhelming, or it may be too direct engagement. That doesn't mean that the person is not a great employee. It just may mean that this is not the exact right fit for them. And so we look for ways of addressing those challenges where the individual is not penalized, but we look at ways of providing the best support. So it could be changing the role, it could be shifting the responsibilities. So again, exhausting every possible option, all the way down to maybe it's time to call it quits. A part of our process in working collaboratively with the employee is that 99% of the time, when we've gotten to a point where we need to call it quits, the individual has identified that it may not be a good fit for them. And, that has been our experience. We've had a very small handful of folks that may not necessarily have agreed, and that happens. But for the most part, because of the practice and the practice that we use, folks that just are not a good fit, they come to the table with that resolution on their own, and then we try to figure out how we can best support them as they transition out. They realize that maybe this is not a good fit because we have exhausted every potential possible option. We've exhausted everything to the point where it's very clear that this is not a good fit. And and there's no wrong or right around that. It just is. And folks are able to walk away whole. This didn't work for me. This is not a good fit for me. This is not something that I can carry. And there's no fault. The person is just able to move on. And a lot of folks that move on from us are honorary employees anyway. That we have so many people who no longer work with us are still very active in the work that we do. We continue to hold on to those partnerships as people move on in the community to do other things, which I'm really happy about. I wouldn't have it any other way. So, some important things to think about when separation is inevitable. You always want to develop an exit checklist, and this is good for us as well as is good for the person that's stepping away. This will ensure that we don't miss the opportunity for feedback and continued support. This will also ensure the employee has all the necessary information. And so even though it's not a good fit, the exit checklist for the employee makes for sure that, legally we keep all of our stuff in order. So things like the last paycheck, having the signed confirmation, the person has turned in all of their keys, passwords to, keys to all doors, cabinets, passwords to phones and emails and computers, and turned in any borrowed equipment, receiving information about health coverage where it applies. And then the most important for me, the biggest, is the exit interview if the individual is willing to do one. In most cases, folks are willing to give us some feedback about the position, the pay, the work relationship, the duties, the location. Everything you could think about, they're able to provide us some feedback. This helps us possibly reshape the position. If it did not work for this individual, what are some things that we might be able to do better the next round? And so anytime there is a transition, there's an opportunity to improve. And we don't think we do everything right. And so there's always an opportunity to improve. So things like reviewing the job description, there may be things that we missed. There may be some things that were required in the role that we didn't think about that the person brings up in the exit interview. Maybe there is something we want to remove from the duties altogether that may not make sense or may have created unnecessary challenges or stress. Like, we have to be able to openly and willingly take on the criticism so that we can improve and make the best possible environment. Using the feedback from that, to make the improvements. And then the other part is creating the space for the team to give feedback, focusing on what supports are needed to improve the position. Anytime that there is a challenge or shift, it doesn't just impact that person, it impacts the whole team. And so the team is also given an opportunity. It's like, okay, that position's vacant. What do you all, the folks that have to engage this position, what do you think is missing, or how do we need to shift this? How does this position impact or engage the work that you're doing. Like all of those things come up so that we again can continue to optimize the opportunity to improve the position, the work that we're doing, the way that we engage, the way that we support. All of that is a part of the process as we're turning a new leaf.
Any reflections or feedback around this piece? I know we've very quickly kind of moved through the whole life cycle of what it's like to be an employee and a supervisor for employee, but would love to hear reflections or feedback too.
I have, my biggest challenge with supervising peers is my agency isn't a peer run agency. They appreciate peers. My executive director and ahead of me loves peer work. He doesn't identify as a peer, but he's been part of legislation for California for peer work, so he really does respect it and enjoy it. But you know, there's expectations from my corporate offices and the agency, and sometimes I just have a hard time with balancing between what is best and what my team needs versus what I have to produce, and you know, or what I have to turn in or get done, and I find myself doing a lot more stuff that I maybe shouldn't be doing or don't need to be doing, but it also interferes with, you know, doing the things I need to do. And I'm always working on that, on finding a good balance between well, like I just recently realized that I need to not protect my peers, my work team. I need to not protect them from the challenges of their work. Like, and if it's hard for them, that's okay, and they can learn through that. Or like if it's not a good fit, I need to allow that to happen rather than always trying to find a way to make it work for them. And I have a hard time with that, but it's a real part of what I have to do.
Yeah, what you're describing is a really common sentiment, that you feel like you're protecting your staff from the leadership, or like, you know, you're kind of this middle layer. And it's a really tricky place to be. And it comes from an awesome place, right, of trying to make everybody comfortable, but then you're taking on the burden and you're having to balance both sides. And really the only way to resolve that is having your leadership on board too. And so I know that's also a complicated point to be at. Thank you for sharing that.
Can totally relate. Can totally relate. And I think for us, you know, having to take on the extra things like you mentioned was having those agreements around the deliverables and what does your role entail. So folks know upfront, this is your thing, you know, and let's continue to have open discussions around what's working in your bucket and what's not. And then that's where we start looking at, does this make sense? Does this work? Is this a fit? You know, it takes a little bit more work and it takes a little bit more support, but in the long run, you will create a larger path of success for the individual, whether they stay or go. It's really helping them learn what their capacity is. It will help your organization be more realistic about the requirements and what they're asking for. You know, it's just a win-win regardless of the outcomes. The focus is, you know, really creating a, you know, a culture of success. But thank you for sharing that. I think that's one of, you know, all of our challenges for folks that supervise peers is that we want them to be successful. And so we do get into the mode of protection. But I think the agreements, what we agree on is the biggest jewel of having the opportunity to work with folks with lived experiences. Let me create an environment where you have a role in your success.
Yeah, thank you. I appreciate that. And I also feel like part of that, also that protective layer that I am trying not to be, I also feel like sometimes I have done, well, in the past, I have done that between them, like refereed when there was conflict, or, you know, I see the strengths of this person and I see the strengths of this person and I try and get them to see, and I don't need to be doing that at this point. That's something they need to be doing for themselves. And I need to be willing to step back. And, you know, I realized I needed to be willing to step back and allow them whatever it takes for them to negotiate that relationship, to work together. And it frequently is good, but when it's not good, you know, then I'm having conversations like that, you know, how I want to see how they're supporting themselves to be able to navigate these challenges, and what is your strategy here and how can I support that, rather than, you know, like, because it gets rough. Sometimes they don't get along. Really different personalities, different ways, and also different coping skills. And when somebody's not feeling well, their coping skills are being cranky and crabby sometimes and not nice. And then I have to step in and say, this is not acceptable on the floor. You're welcome to take a day for yourself or whatever. That's my biggest challenge in supervising peers.
But you're on it though. You're on it and you're in the mix. And so you're identifying, and that's the emerging component. The more that we do it, the more that we identify where we need to shift from protection to advocacy to support. Like I support you advocating for yourself. Here are the options, and the individual can decide what the best move is for them. And they are fully aware of what the outcomes could be, you know? But thank you. I really appreciate the dialogue with you.
I have one question. I'm not sure at the end. I just wanted to ask everybody something when you're at the end. I don't know where that is.
Guess
Oh,
what?
you're
We're
there.
at the end.
Okay.
So, you know, this is our contact information. So this is me, Katrina, and Genevieve. This is our email, our fancy new logo that's not even 30 days old, and our new name that's a couple of months old, brand new for 2023. What I'd like for folks to do is to take an opportunity in the chat to just give us some feedback on what was the most important thing that stood out for them, and what are some things that they felt we could have done better. And if you have any questions, we are open to answering questions now. And Julie, you're first in line. You have a question?
Well, thanks. Yeah. Here in my community, we have something called a peer work group, where we meet the second and fourth Fridays of the month early in the morning, and peers, anybody who works in peer work in our community in any capacity, we all get together, and it's part support and it's part skill building in peer work. But I, from that, wanted to create a work group, a support group for people who supervise peers. And so I'm working on that. I want it to be a virtual thing. And I'm just putting that out there, and I'm interested in collecting names of people who might want to participate. And it might be something just once a month or something, but it would just be really neat. I don't feel like I have support in my community, and all of my support I live in a small Northern California town, and all of my support comes from other areas. And I know I'm not alone in that. And I want to have that mutual support of each other, and also the benefit of other people's experience in this. So I'm going to put my name in the chat and my email address, and you're welcome to reach out to me and tell me you're interested in doing that if that's something you want to do.
It's definitely yes. The big response is yes, absolutely. You know, we've been doing this particular work around peer training since 1998, so a very long time, right? And so we've put out so many graduates, and we know that they are entering communities where folks don't have a lot of experience supervising peers. And we know that there are a lot of folks with lived experience that are also in the position now, more recently, supervising peers. And there is not a lot of training or support around these unique situations that come up when you're supervising a peer, or this duality of I'm a peer and I work in an organization that's not peer-based. So you're hitting up against some policies and practices that may not jive with the needs of the people that work there, right? So again, I'm totally interested. I think there's some work to do. I think that this is absolutely a lane that needs more attention. And I absolutely would love to be a part of anything that you're interested in building.
Oh, thank you.
Mhm.
I will put your name on my list.
Please do. So, any other feedback? What worked? What didn't work? What we could have done better? What you liked? Any standouts? Well, that's it. We nailed it. We hit it out the park. I want to thank everyone for being here today. I know we're at the end of the day and it's been a very long day, so I'm very honored to have the folks that have stayed all the way to the end. It means a lot to us that folks really value the work that we're doing, and I'm looking forward to building some partnerships.
Were you going to be able to share with us the 30, 90, and 60-day format for your?
Actually, we have your email address. We can
Okay.
send it to you. Unless, Genevieve, you want to share it really quickly, some of the documents that I would rather send it to you. Or
Great.
maybe even we can have a call so we can talk about how we walk through the process of using it.
Absolutely. Thank you.
This is a little bit different. We work from the strength of what people want to bring to the table. And of course, there's opportunities to talk about things that have not worked out, but that conversation is more built around the solution.
Mm-hmm. Mm-hmm.
And it's really cool. We have kind of like the default template people use for annual reviews in corporate settings or any setting, and then how we shifted it to be peer centered. And I think like looking at both of those together is really important, or if you wanted to show it to other supervisors.
Yeah, I would appreciate that, because I have something similar that my agency requires, but and just recently decided I needed to implement a very specific, clear peer supervision plan for my team. And the corporate one is a little more corporate focused. And I was like trying to think about how can I rework that. And you guys have already invented the wheel. I don't want to invent the wheel again.
You can definitely build from it for sure. I love it. So I think it's a great tool. So if there isn't anything else, again, thank you all for spending the late afternoon, evening with us. This has been great. Thank you for giving us the opportunity to share the work that we do. And our information is in the chat. Please feel free to reach out to us if you have any further questions later.